When most people think about pediatric brain tumors, they think about tumors that are not curable or tumors that are going to affect someone in a very real and serious way. The reality is that the majority of pediatric brain tumors are very treatable through surgery and advanced chemotherapy options and radiation therapy. We really have a number of different tools and clinical trials to be able to treat their brain tumor, and the majority of kids do really well. What we've learned about pediatric brain tumors in the last 5 years has been really an exponential growth compared to the prior 10 or 20 years. And looking ahead, we're poised for an understanding the diagnosis of brain tumors, the best treatments, how brain tumors interact with the developing brain, really optimizing cognitive outcomes for kids with brain tumors. And Siteman Brain Tumor Center is going to be leading that charge on all fronts: clinical aspect, clinical trials, research, and I'm really excited to be part of such an amazing team. Some of the biggest concerns that families have when they are faced with the diagnosis of cancer or a brain tumor is really the unknown. There's a lot of unknowns with what the ultimate diagnosis is, the treatment plan, and I find that connecting with families and being able to acknowledge that there are some unknowns, but that myself as a pediatric neurosurgeon, as well as our neuro-oncology team and the radiation oncology team, we're all gonna work together to carry that patient and family through the process of diagnosis, surgery, treatment, cure, and being able to hold their hands throughout that process and really be a connected team. I think it takes some of the anxiety and uncertainty out of the process, knowing that there's a large team that's taking care and focusing on their child. When I started neurosurgical training, I did not yet have children. And throughout the end of my neurosurgical training, through my fellowship and in my practice, I now have 3 young daughters. And I think my approach has been similar, but I've learned a lot over that time. I've learned a lot not only from my experience having 3 young daughters and how I would want to experience medical care from the setting of a parent, but also my experience of learning from patients and their families. My approach has changed. It's changed to, I think, perhaps being a bit more family-centric and understanding that I'm not just treating someone's child, I'm treating the whole family. What I've also learned is that each family is different. Each patient is coming from a different perspective, and there are some families that appreciate hearing information in one way, and other families may appreciate hearing in another way. So it's definitely been an evolution, and I continue to strive to provide the best patient care, not only in the operating room in terms of taking out a brain tumor, but also making sure that patients and families feel safe and feel supported throughout their journey. One of the most rewarding parts of my job is being able to meet someone at the time of their diagnosis of a pediatric brain tumor and not only be able to take them through surgery and treatment, whether that involves chemotherapy or radiation therapy, but then being able to follow that patient and their family through the remainder of their childhood or through adolescence and being able to see them on the other side of their diagnosis when they're successful in sports and school. It's really rewarding to be able to continue to have a relationship with the family and seeing that patient succeed in what they're passionate about.